Most hair products fail because they treat hair and not the hair follicle. Hair does not grow from scalp surface. It grows from living structure deep inside the skin called as hair follicle. If you don't understand this, hair loss treatment will never make sense. Hi, I am Dr. Samiksha Tyagi, plastic and hair transplant surgeon. In this video, I will explain scalp and hair follicle science in a very simple but interesting language. What the scalp really does. Scalp is a skin, but it's a specialized skin. Its job is to protect your hair follicle, provide blood supply to them, maintain a healthy surrounding environment for your hairs. A healthy scalp helps hairs, but scalp care alone cannot fix your damaged follicles. Now let's talk about hair follicle or hair follicle anatomy. Most people think that hair grows from scalp surface, but the real story actually starts much deeper. In fact, every single hair on your head grows from the tiny living structure underneath the skin, which is called as hair follicle. And this hair follicle is very much complex than most people imagine. Think of a hair follicle like a mini factory which is inside your skin. It is a tiny living organ that continuously produces hairs. Each follicle works independently and goes through its own growth cycle. Not all the hairs are growing at same stage. Every hair is into the different stage. Surprisingly, your scalp has around 1 lakh follicle. That means 1 lakh tiny factories are working continuously to produce hairs, and that too on a different timeline. The next important part is the hair bulb. It is the bulb which is at the base of hair follicle, and this is the production center of hair. Inside the bulb, there are special cells which divide rapidly and push forward their hair shaft. Think like a root of a plant, from where hair actually begins to grow. And the clinical importance: when your hair bulb is damaged because of inflammation, scarring or severe disease, hair will stop growing permanently. That is why conditions like scarring alopecia can cause permanent hair loss. Inside this bulb, there is very important structure called as dermal papilla. It is a tiny structure that contains blood vessels that supply oxygen and nutrients to the follicle. If you can think, it is a nutrition and control center for your hair growth. The dermal papilla also sends signals that decide how thick and long and strong your hair will grow. That's why in many patients of hair loss, especially patterned hair loss, dermal papilla, it is the structure which is sensitive to hormones like DHT, and that's why follicles, they gradually shrink, they become thin, more thin over a period of time. Next part is stem cell zone. It is also called as bulge area, which contain hair follicle stem cells. These stem cells are responsible for regenerating the follicle every time the new hair cycle begins. It is a repair and renewal center in simple words. This is why this is very important for transplant. We transplant follicle, we actually transforming these stem cells to cell-rich follicle that can keep hair production in a continuous way for years to come. The next important is nerve supply. Whenever you touch your hair, you feel them. A slightest touch you can feel. This is because of this nerve endings. These nerve signals are very important and they influence your hair growth cycle as well as follicular health. Now let's understand why many products don't fix hair loss. Because hair thickness, hair strength, hair growth is decided deep inside the follicle and not on the surface. The shampoos, the oils, the serum which you are applying just outside, and they are not improving your texture, or they cannot change anything that is happening to hairs actually. When follicles are healthy, hairs grow thick and strong. But when hair follicles become weak, inflamed, or they are hormonal sensitive, hair becomes thin and eventually they fall out. That is why for hair loss treatment, the real focus should be protecting and restoring your hair follicle. Let's understand why shampoo and oils have limitations. Shampoo, oil, serums work on the scalp surface and hair shaft. They do not reach follicular bulb. That's why oil can improve the shine and texture, but they cannot reverse genetic hair loss. This does not mean that oils are useless. It means they have their limitation. Hair follicles can be damaged by many factors. The most common are DHT hormone, chronic inflammation, nutritional deficiencies, hormonal imbalance, long-standing stress, and over time, all these factors, what they do, they shrink your hair follicle. This is called as miniaturization. Miniaturized follicle produce thinner and weaker hair, and eventually they stop producing hair. Let's understand what medical treatments do. Medical treatments target the follicle. They improve blood supply from beneath. They reduce their inflammation. They support growth phase of the cycle. They make your hairs grow for a longer time. That's why scientifically proven treatments work slowly but consistently. Let's see what is permanent versus what is reversible damage. This is very important. Here is an important truth. If hair follicle is dormant or weak, it can be revived. If a follicle is absolutely destroyed, it cannot be revived naturally. That is why timing matters. That is why early treatment saves follicles and gives you good results. To summarize, hair grows from follicles and not from scalp surface. Scalp care supports hair health, but follicle care determines hair survival. Understanding this saves you from false promises. If you want science-backed information like this, subscribe to our channel. Thank you.